And welcome back. I'm Mabel Jong, and this is the last day of the World Healthcare Congress here in Washington, D.C. In our studio, we have Dr. Robert Heinssen, who is Director of Division of Services, National Institute of Mental Health. Did I get that right?
Services and intervention research, but otherwise perfect.
Thank you so much. Well, let's get to the really important stuff. Is there growing information that we should be incorporating mental health issues or screening in the primary care setting?
Yes, I think there's two streams of information that are very important here. The first is studies that have looked at the prevalence of disorders like depression and anxiety disorder in the primary healthcare population. We can estimate that about 1 in 5 people who are receiving care in primary care settings suffer from either one or the other. So the prevalence is pretty high. I mean, that tallies up to tens of millions of Americans per year who are in primary care that have diagnosable mental conditions. So that means the numbers are telling us it's an important problem. A second piece of information is that we know that untreated mental illness, when it occurs in combination with a medical diagnosis, is often a contributor to poorer outcomes, both for the psychiatric condition and the medical condition. Mm-hmm. And then the third piece of information is we now have a number of studies that illustrate when you combine, you integrate behavioral health care and and general medical care in a primary care setting, we can achieve superior outcomes for depression and anxiety disorders, as well as complex medical conditions such as diabetes, cardiovascular disease, respiratory illness. Mm-hmm. So we know that there's a high degree of prevalence. We know if you don't pay attention to those disorders, you get worse outcomes. And most importantly, we know when you integrate the care, you get better outcomes for both sides of the equation.
Okay, so there seems like there's a very strong case to be more proactive on that front. When might we see more action taken in the primary care setting, where this is more commonplace to have primary care physicians screen for depression or other mental illnesses?
So I think the model that has emerged as one that could work in primary care is one that's referred to as the collaborative care model. And in this model, it's actually adding a behavioral health expert to augment the activities of the primary care physician. And this person could be a nurse practitioner, a social worker, or other mental health provider, or even another nurse who's associated with the practice. And their job is to pay careful attention to the patient level outcomes for individuals who are receiving the care. So what they do after the primary care physician refers them to this person, they document the degree of depression or anxiety, determine whether the person meets a diagnostic threshold. If so, they work with the primary care physician around a care plan, and then this extender becomes the person who monitors the patient's response to it, helps the primary care provider tailor the treatment so that we're getting the maximum efficacy, minimizing adverse events, and keeping the person's motivation high for maintaining the treatment. Mm-hmm. Now that model, collaborative care, has been implemented in a large number of healthcare settings. It's not the national norm yet, but there are regions that have adopted it, or care systems that have adopted it. And it's proven to be one that can actually double the impact of the psychiatric treatment for both depression and anxiety disorders, and then speed recovery for or add to the efficacy of the medical treatments for the other disorders.
Right. Well, earlier you had mentioned some very significant data about the number of people who could be impacted by growing programs to address this. Has the measure for these people become more sophisticated so we know more about them, or is the number of people growing that have mental issues that should be dealt with?
That's a very, very good question. So you never know how many people you have until you start measuring, and then you have an idea about what the prevalence is in a population, and you can track it over time to see whether it's growing or not. Well, here, I think the first step has been through the introduction of screening programs. We have a pretty good sense that a large portion of people have these comorbid conditions, the psychiatric and the medical. Right now, we don't have any information that the size of that cohort is growing, but it is sizable. And because it's sizable, it makes it a very important population to target for better care.
And are you confident that once identified and once there is a course of treatment, that it could be very readily available for some sort of solutions to come about for people and to get them on a healthier track?
Yeah, I think there are a variety of studies that show different variations of this approach that make it work with, for example, ethnic minority populations, that it can be tailored to address their particular concerns and increase access to the care. So basically, when you have somebody who's paying attention to specific symptoms, they're making sure that the treatment remains targeted to those symptoms. They're measuring carefully over time the relationship of the treatment to symptomatic improvement and suggesting timely adjustments to treatment, perhaps changing medications or changing dose, or adding, augmenting it with psychoeducation or cognitive behavioral interventions. When you have that kind of tailoring going on, it's pretty predictable that people will get better.
I like how you mentioned earlier that you've had some great discussions with your colleagues after you got off the stage doing your panel. What sort of action might that result in, your conversations here?
So we were having a discussion about some exciting developments in first episode psychosis. And and we were talking a little bit about how the Center for Medicare and Medicaid Services has jumped into this arena and supported the care. And a question came up is, well, what's the role of commercial insurance, and how can the science inform what they're doing, and how can they better take care of this population? So some of the subsequent conversations were just around that. How can we have a conversation that results in concrete actions that can be taken place to expand this care beyond the public insurance setting into the commercial arena.
Fantastic.
So that'll be something. It'll take conversations and meetings, but it got started today.
Absolutely.
So that was a very positive event.
Terrific. Okay, Dr. Heinssen, thank you so much for your time today. We
Thank
really
you very
appreciate
much.
it.
Very nice to meet you.
Thank you. Nice to meet you. And I'm Mabel Jong. Thanks for watching. More content to come.